Hi, my name is Crystal Hazelton. I'm a pelvic health physical therapist here at the Naval Medical Center, San Diego. I'm here today to talk to you about common concerns for the pelvic floor and the core for women who are pregnant and postpartum. We're here to support women in their health and fitness goals. So what are the common concerns for the pelvic floor and the core? As a pelvic health physical therapist, I see a lot of patients in my clinic with these concerns. They include urinary incontinence, which means that you're leaking urine, pelvic organ prolapse, that can feel like pelvic heaviness or vaginal heaviness, fecal incontinence, which is where you lose a little bit of stool or you're not able to hold gas back, constipation, so a lot of straining to have bowel movements, and pain with intercourse is actually pretty common also. And diastasis recti, that's where there's a little bit of a split in the middle of the belly, or some people just say they feel like their abs are too weak after they had a baby. And then also a lot of pelvic girdle pain. That could be low back pain, sacroiliac joint pain, pubic bone pain, pretty much anything in that pelvic girdle. So what are the risk factors for pelvic floor or core problems? There are really three main categories. Two of them we don't have much control over, and the third one, there's a lot we can do about it. So the first category is childbirth. Just the act of being pregnant is actually a risk factor for pelvic floor problems. The more pregnancies you have, the higher the risk factor for pelvic floor problems. A vaginal delivery has a higher risk for pelvic floor problems than a C-section, although again, any pregnancy does have some risk involved. And forceps or vacuum-assisted delivery, that has a higher rate for pelvic floor, or a higher risk of pelvic floor problems. Pressure on the pelvic floor, that's the second category. This is one we are going to talk so much about throughout all of these videos. This is the one we actually can make a pretty big change on. So obesity or being overweight, those are pretty high risk factors for pelvic floor problems. Now, I know that absolutely no woman ever wants to talk about her weight. It's a pretty sensitive topic, but there's just no way around this. That pressure straight on the pelvic floor, especially when it's weaker and healing after having the baby, that is a risk factor for pelvic floor problems. So we want to support you in your weight loss journey, and the tips we have here today should help out with that quite a bit. Constipation is very common during pregnancy and postpartum, but it's also a risk factor for pelvic floor problems. So when you're chronically pushing or straining to have a bowel movement, that is putting pressure on the pelvic floor, which makes it a risk for pelvic floor problems. So we want to look into how can we decrease constipation or that strain with a bowel movement. Wind instruments, it's kind of a random one, but actually playing wind instruments is a lot of intra-abdominal pressure that's involved with that, so that can create pressure down into the pelvis. Chronic coughing is also something that maybe you can get checked out from your doctor to see if there's a way to address that, but a lot of chronic coughing creates downward pressure. And then repeated heavy lifting. Now this one's an interesting statement. It's not necessarily weight training heavy lifting. It's actually more likely gardening or household tasks or work type of heavy lifting. So that is a risk factor for pelvic floor dysfunction. And then the third category is stuff that we don't have a lot of control over and not really related to pregnancy or postpartum, but menopause, aging in general, connective tissue disorders such as hypermobility, spectrum disorder, or Ehlers-Danlos syndrome, and also prior pelvic surgeries. So those are all risk factors. So again, we may not be able to change a lot with the childbirth factors or the other factors, but we really can affect those pressures on the pelvic floor. So keep watching these videos to find out how you can change those things. All right, sailors, you are the reason that we created this entire program. When I first came on board a few years ago, it was during a PRT cycle, and there were several women who came into my clinic complaining about pelvic floor problems that were really limiting them in passing their first PRT after having a baby. Or maybe not limiting them, but a couple of them actually were putting on a diaper so they could run hard enough to get the score they wanted to get on the PRT. And that's just not okay. Nobody needs to put up with that. So I was curious if there are other women in this situation or if it was just kind of a one-off. So we really decided as a pelvic floor team to take the helm and work on improving warfighter readiness by helping women pass that first PRT through this series of pregnancy and postpartum classes. All right, so looking back, we definitely found that there are other women who experience this. It's going all the way back to 2010, there was a study that found that 23% of enlisted sailors and 14% of officers reported not passing at least one part of their PFA. Now, this is back when they only had 6 months to take their PFA, but that's still a number that we don't like. And then in 2020, there was another study that was done that found that women postpartum, up to 2.5 years postpartum, were more likely to have a PRT failure. So these are numbers that we're really not okay with, and we want to improve that. And so we hope that this video series helps you. All right, the good news is that you do now get 12 months to return to your PFA. You don't have to get it done in 6 months any longer. That is definitely a big help. There are ways that you can speed your recovery. So starting out slow and listening to your body, that helps to prevent setbacks. So that's really important, that slow, consistent, progressive load training. Improving your pelvic floor muscle strength and endurance training, and in this video series, you'll learn how to do that. Appropriate abdominal strength training. So in this video series, you're going to learn about changes in the abdomen and how and why it's so different to do core work afterwards, and what's the best way to do your core work. And then also preventing extra pressure into your pelvis. So we talked about trying to lose weight, not straining with bowel movements quite as often, decreasing coughing, all of that kind of thing. And at 6 months, you have the opportunity to take a practice PFA. And that's really helpful because it can help to identify if you're having challenges, and then your provider will make sure that you have the resources necessary to help you make it to that 1-year mark so you can take your PFA. All right, let's talk about the benefits of exercise. Why is it good to exercise? We'll get into if it's good to exercise in a little bit, but here's the why. There are actually benefits for the mom, for the baby, and for delivery. So maternal benefits include a lower incidence of pregnancy-related weight gain, a lower incidence of gestational diabetes, and a lower incidence of high blood pressure, that kind of a thing, preeclampsia. And depression is another thing that is lower if you are exercising. So there's a lower incidence of depression for moms. The benefit to the baby or your fetus is that there is a lower incidence of preterm birth, a lower birth weight. For delivery, you have a decreased incidence of C-section and an increased incidence of a vaginal delivery. So exercise is definitely fantastic. It is helpful for maternal benefits, fetal benefits, and delivery, as long as you are allowed to exercise per your OBGYN. So we have some examples of exercise that are known to be helpful for women. So you may be wondering, what can I do? I'm just so scared to start exercising. What is safe for me? Again, we'll get into more details on safety with exercise. Generally speaking, for those who are allowed to exercise, walking is fantastic. For most people, walking is one of the best opportunities to exercise. Stationary cycling with a seated bike is fantastic also. Aerobic exercises, dancing, resistance exercises like resistance bands or light weights. Stretching exercises are also helpful, and water therapy, so swimming or water aerobics. These are all great options for exercise. There was a study done to find out how we could decrease gestational diabetes. They took 300 women who were overweight or obese, and they looked at exercise or no exercise. So those who initiated cycling in their first trimester, doing at least 30 minutes, 3 times a week, all the way up until 37 weeks gestation, they had a lower incidence of gestational diabetes. They had less weight gain, which we already talked about. That's a risk factor for pelvic floor problems. And they had a lower birth weight, so they weren't having babies that were as large with gestational diabetes. So seated bike, 3 times a week, 30 minutes, that's it. That's a pretty great option for exercise for you. So we just talked about the benefits of exercise, but the big question is exercise actually safe for you? The answer is, for most women with uncomplicated pregnancies, yes, absolutely. You do need to have an evaluation from your OBGYN or midwife to get that clearance, so they can just make sure that you have a normal, healthy pregnancy and that you are okay to exercise. Next. So who shouldn't exercise? There are some people that should not exercise. And this is something that your OB or midwife will talk to you about. So if you have heart disease, you may be able to exercise, but you might have some special guidelines. Same thing with lung disease, women who are pregnant with twins or more. If you have placenta previa after 26 weeks of pregnancy, preterm labor during this pregnancy or ruptured membranes, preeclampsia, or pregnancy-induced high blood pressure, or severe anemia. Now again, there are different levels of exercise that are appropriate, and that's up to your doctor to discuss with you. The American College of Obstetricians and Gynecologists have some specific exercise recommendations for you. So like we already talked about, women with uncomplicated pregnancies should engage in aerobic exercise and strength training. So for aerobic exercise, they recommend 150 minutes of moderate intensity exercise every week. So you can actually divide that up any way that you want to. You can go as low as 10-minute intervals. So if you're having a couple weeks that it's really hard to get up and move, just park far away and walk. That 10 minutes could definitely count towards your 150 minutes. And what is moderate intensity? It means that you're working hard enough that you're a little bit short of breath. You're a little bit hard to talk, but you could still talk, but you wouldn't be able to sing. That's kind of a good rule of thumb. And you're going to notice that that changes throughout your pregnancy. Maybe one trimester, you're able to tolerate a lot more exercise than another trimester. So this is really different for every person, every week, and every pregnancy. It's okay to continue vigorous exercise if you're having no problems with it, if you have a normal pregnancy, you've been cleared by your doctor, and if you've been doing that consistently. But that consistency is important. So maybe if you had a first trimester with a lot of nausea, you couldn't get out of bed, so you spent a long time, more than a month of not doing any sort of exercise, going right back to that vigorous activity is not as much of a good idea. So you want to start slow and build your way back up. So it is okay to continue vigorous exercise as long as you've been doing it prior to pregnancy. And then we also recommend having strength exercises twice a week. So you can hit all the body parts twice a week, and that'll be great. So when should you stop exercise? You should stop if you have vaginal bleeding, abdominal pain, regular contractions, amniotic fluid leakage, shortness of breath before you even start exercising, dizziness, headaches, chest pain, muscle weakness that makes you feel off balance, or any calf pain or swelling. So those are all of your red flags. You need to stop if you have that happening. So those were the red flags. What about the things to be careful of? So you should really start exercise gradually. There are a lot of changes that we'll go over later, but the short answer is slowly and gradually increase your exercise load. A little bit slower than you would have if you weren't pregnant. Make sure that you're staying at a moderate intensity. Again, that's just a little bit short of breath. So you're working a little bit, but not so much that you are out of breath, you couldn't talk. You want to stay hydrated. You're going to need more fluids than usual. You want to avoid overheating. So extremely hot environments, be careful of exercise in that location. Avoid lying flat on your back, especially in that third trimester. Wear supports. So sports bras are really helpful. Support hose if you have a lot of swelling in your legs. That's really helpful. It makes it easier to move and to exercise. Maternity belts are great. If you were given an SI belt, that's also great to use when you're exercising. It's good to avoid contact sports or anything that you have a high risk of falling. So those are your precautions during exercise. So what about weightlifting? Is weightlifting okay? This is an area that we have the least amount of studies done. There was one study that showed that heavy weightlifting is not recommended because you can actually have a decrease in blood flow to the fetus. So this is heavy weightlifting. This is not light resistance or moderate resistance. So the statement by ACOG is that athletes who wish to continue strenuous activity during pregnancy need to have a clear understanding of the risks and then to have that discussion with their doctor. So if you really want to continue exercising, you've been doing it consistently, go ahead and have that one-on-one conversation with your OBGYN to determine if it's okay for you. All right, so what about the elite athlete? If you were an elite athlete prior to pregnancy, it's generally safe to keep training the way that you were training. Sometimes this will require modifications, so that's hard to accept at times, but really feel what your body is experiencing and modify if you need to. Let's talk about what an elite athlete is. An elite athlete is not a really good everyday athlete. An elite athlete actually has several years experience in their particular field, and they're training year-round at a high level, and they're training at least 5 days per week, about 2 hours per day. So our recommendation for an elite athlete to continue is based off of that definition of an elite athlete. So far, we have no studies to show that vigorous exercise is safe in the first or second trimester, but we do have studies that show that it's safe in the third trimester for elite athletes. So for other resources, here is a list of resources for you. So the American College of Obstetricians and Gynecologists, the website is listed. And then there's a great resource on the U.S. Department of Health and Human Services. It's called the Move Your Way website. And there is a URL listed there for you. It has some great explanations of just different fun ways to get active during and after pregnancy. So how is your body changing during pregnancy? There are a lot of changes. The first thing is that you have some cardiac changes. So your blood volume increases, your cardiac output increases, your heart rate increases, and your blood pressure for most people actually goes down. Your rib cage can expand, especially as the baby grows if you carry high. That can put pressure up on the thoracic diaphragm. That's the muscle that helps you to take deep breaths. And you just fatigue faster when you're pregnant. Other ways that you're changing: weight gain. There's a good amount of weight gain for everybody, and that number is different for everyone. So definitely ask your OB/GYN how much weight that you should be gaining. You're going to have a shift in the center of gravity. As your stomach comes out here, you may start to feel like you want to lean back. So those are some changes that affect how you exercise. The growing baby does put pressure straight on the bladder and your pelvic floor. And then you're going to get an increased laxity in your joints. So bones are held together by ligaments, and the hormones in your body during pregnancy, they actually make your ligaments a little bit looser. And that makes the joints a little bit looser, so you feel more flexible. This is such a good thing because it allows you to deliver the baby during, with an easier expansion of those bones during delivery. But it makes exercise a little bit more challenging prior to delivery. So what muscles are changed the most by pregnancy and delivery? The answer is your pelvic floor muscles and your abdominal muscles. So again, coming back to the reason we're here today is to talk to you about challenges in the pelvic floor and challenges in the core. So some general recommendations for exercise. You really want to avoid anything that causes you to bear down. Again, we're thinking of pressure management. We're trying to avoid the risk factors that put pressure down into our pelvis. So really avoiding bearing down when you're weightlifting. Some people call this Valsalva, some people call it bear down. There's a big debate on what those words mean, but anything that puts pressure down into your pelvis, we want to minimize. You want to establish good core contraction or engagement and good breath control. Breathing smoothly through exercise is really helpful to prevent downward pressures, and engaging your core where you lift and support your belly up and off the pelvis is also really helpful. You want to be able to progress to deep core engagement with all of your ADLs. So if you're doing dishes, can you engage your core to kind of help support and lift up the structures off of your pelvic floor? It's great to start in side lying or supine, which means lying on your back, and especially in that first trimester. That's a little bit easier to do, and then as you get better, try other positions with all of your exercises, all of your strength training. You can progress to hands and knees. That's a great position to relieve back pain, to strengthen your core, strengthen your hip girdle, sitting and standing, and then just give yourself the permission to modify exercise whenever you need to. So when we say modifications when you need to, what does that mean? How can you modify exercise? Really depends on the exercise, but some general recommendations. You can start on a higher surface. So for example, maybe first trimester, you could still do push-ups on the floor, or you could do planks on the floor if you're active duty. But maybe as time goes on, the belly gets bigger, that's a little too hard for you. So you could go to a taller surface. You could do those push-ups or planks on the countertop. And then third trimester, really close to delivery, even that could be too hard. You can actually do those against the wall. So get creative, raise the surface up. That makes the exercise easier for you. And squats and lunges, they still can be performed as long as you feel good doing them. Again, listen to your body. It's really good at telling you what you need. It's okay to increase the depth of an exercise if you feel good with it. If you don't, just shorten the depth. I usually tell people to put a box behind them. If they can't do a full squat, you can maybe squat to the box or to a chair. So that limits how deep you're going, but you can still get some strength training going with that. All right, so you know precautions with exercises, red flags with exercises, how to modify exercise. It's a lot of information. What can you do right now? So remember to get in your 150 minutes of cardio, enough that you're feeling a little short of breath, but not so short of breath that you couldn't talk. Get some leg strengthening, some core strengthening, and some arm strengthening in there. Twice a week is fantastic. Back health, some very general recommendations. You could do yoga exercises like a cat-cow. Just really be conscious of your posture with all of your exercises. And for your pelvic floor, do quick contractions, endurance contractions, and make sure that you're resting your pelvic floor also. And then also perineal stretching, which is really important starting at 35 weeks. So we're going to go into depth on all of these recommendations in other portions of this video. So here are some examples of exercises that you can do on your hands and knees. These are great to strengthen your shoulder girdle, your hip girdle, and your back, and it usually feels pretty good to have your belly in that different position. So starting in your hands and knees, draw your stomach in like you're hugging your baby with your belly. And then if that's easy enough for you, you could extend one leg back like the middle picture, and then bring it back. And then repeat that several times until you feel tired. Go to the other side. Another option is you can actually bend the knee to get a little glute max activation, and then do what's more like a donkey kick, same position, bringing that foot straight towards the ceiling. So these are great exercises that you could do in the hands and knees position, and it hits a lot of different muscle groups. Some easier exercises to start out with. You can just lie on your side, put a pillow between your knees, and do a clamshell. This is great for hip strength. Maybe you don't have a lot of energy to do a lot of bigger exercises. This is a great thing to do to maintain strength, but not be too intense. Same positioning, but a straight leg raise. And then on the far right on the top, you see a picture of doing a push-up on an elevated surface. I think this is great. You're cooking food at home, something's in the microwave, go ahead and knock out a few push-ups on the countertop. It's a great way to sneak exercise into your day if you're really busy. And then if that's too hard, you can actually do push-ups on the wall. So the bottom left picture demonstrates that. And then this is a picture, the second one from the left on the bottom is a lunge. So your balance gets a little bit wonky as your belly gets bigger. It is okay to hold a stable surface so you're not worried about balance, but you can still get some strength training in. She could even hold a dumbbell in her hand with that lunge. And then wall ball sits or squats, those are fantastic because the ball actually helps to stabilize your pelvis as you do the squat. So usually this one feels really good. It gets rid of some of the back pain, pelvic girdle pain, and it still is maintaining strength of your legs. After you have a baby, you're going to be bending and coming up from the floor quite a bit. So the stronger your legs are, the less pressure into that pelvis. So again, it really helps to support your pelvic floor by keeping your legs strong. And then a similar picture on the far right is a wall squat, and this time she has some dumbbells, so you can just increase the weight as you feel is appropriate. Now, when you do squats, it's really important to have the right posture. If you tuck your tail under and you have kind of a flat back, then you're more likely to have extra pressure down into the pelvic floor, and that can be really uncomfortable and can feel like that the baby is just pushing right on the pelvic floor. So make sure your back is neutral. Not arched excessively, but it should have a slight rounding in it. So you can see those two positions. The one on the far left, her back is a little too flat, and on the right, or the middle picture there, that's a really good position for her squat. You can add weights. If it's too hard to put your arms behind your head because your belly's so big with a barbell, you can just hold some free weights. So there are a couple of good images there of a squat with some free weights. So those are typical exercises most people are familiar with. There's another exercise that's just so important for pregnancy and postpartum, and this is called the diaphragmatic breath. This is an exercise that includes the abdomen and the pelvic floor. We could probably spend an hour talking about this exercise, so I'll do the best I can in a short amount of time. When you take a diaphragmatic breath, you're using the muscle inside of your rib cage. At rest, it sits like this. When it contracts, it comes down, and that puts pressure down into the abdomen. You then see your stomach rise, and the pelvic floor should gently stretch. So an inhale looks like stomach rising, a little bit of lower ribs coming out like an umbrella. You should not have a lot of upper rib lifting when you're inhaling. So inhale, try to skip the rib cage, and just let your stomach expand and those lower ribs expand. As you exhale, feel your ribs come back to normal. Feel your stomach come back to normal. Feel your pelvic floor come back to normal. Now, if you exaggerate the exhale with an extra few seconds, you should feel your stomach contract and you should feel your pelvic floor contract.